Our vision at Diabetes Victoria is a world in which diabetes can do no harm. For over 70 years, we have supported people with diabetes in Victoria. We now enter a new chapter with a bold new strategy to bring a brighter future closer, where people with diabetes live well and longer, and there is a cure for all types of diabetes. Our strategy focuses on outcomes, guided daily by our vision, commitments, goals and values. Diabetes is one of the biggest health challenges confronting our state. Almost 400,000 Victorians live with diabetes. A person living with diabetes is 4 times more likely to have a heart attack or stroke and is at higher risk of kidney failure and amputation. Access to diabetes care varies, especially for people living in remote areas. For people living with diabetes, life is a constant balancing act. Each day is a series of choices and often challenges. On average, they will spend 8 hours every year with a health professional while managing the condition themselves for the remaining 8,752 hours of the year. It's a condition that knows no boundaries, touching every community, every day. The diabetes epidemic is rapidly progressing, with 90 Victorians being diagnosed every day. We cannot wait. The time for action is now. We take pride in our strong community connections, and we are dedicated to working closely with Victorians affected by diabetes on what matters most to them. We will partner and collaborate with government, healthcare professionals, research institutes and industry. We will continue to fund research to improve treatment, care and find a cure. Our strategy is ambitious because all people affected by diabetes deserve to benefit from the latest research breakthroughs and have better access to quality healthcare, treatments and technologies. We will empower people living with diabetes to manage their condition their way, free from stigma, discrimination and the harmful impacts of complications. To see our vision become a reality, we are committed to
valuing the lived experience of all people affected by diabetes and amplifying their voices.
Driving change for impact by building and strengthening our partnerships and advocating for system change.
Improving health outcomes for all Victorians affected by diabetes, ensuring fair and equitable access to services and support.
Creating urgency with compassion, identifying and advocating for unmet needs and creating solutions.
Collaborating with people with lived experience of diabetes and those supporting them.
Our purpose and commitments will guide us in achieving 6 goals. Fewer people will develop diabetes. More people affected by diabetes will have access to a timely diagnosis and the quality healthcare, education, treatments and technologies they need. More people with diabetes will be empowered to self-manage their condition their way with confidence. People will live free from diabetes stigma and discrimination. People with diabetes will live free from the harmful impacts of complications. More people will benefit from research breakthroughs to prevent, manage or cure diabetes. Our work encompassing advocacy, policy, programs and services and research will be driven to achieve these goals. Among our key focus areas, we will
continue to invest in research and strengthen Victoria as a global hub for diabetes research excellence.
Collaborate and partner with government and other stakeholders to make the necessary healthcare system changes to enhance and improve access to quality care.
Collaborate with healthcare services to identify service gaps to inform specialised training for health professionals.
We will expand our innovative social enterprise businesses to help fund community programs and services and research.
Our organisational values will guide us to achieve our vision as we apply innovative thinking, draw on the courage of our convictions and create positive impact. Our ambitions are bold, but the opportunities for change have never been so great. So many lives depend on our work now and into the future. Together, we can work towards a brighter future for all Victorians affected by or at risk of diabetes. Join us as a volunteer, staff member, donor, partner, researcher, clinician or campaigner. Together, we can make the changes needed to create a world where diabetes can do no harm.